Hello, everyone. Welcome to the third section of Diving into Research, titled How to Conduct Responsible Research. My name is Chineyangwa, and I am also a first-year Maternal Child Health student. Before enrolling in the Maternal Child Health program, I was a medical doctor working in a children's hospital in Nigeria. There was this sense of fulfillment I got and joy from just treating ill children and seeing them recover. The smiles I saw on the faces of their parents were priceless. It always made my day. However, there were other times I felt angered from seeing children die from preventable illnesses. That was when my curiosity to explore public health began. I then proceeded to South Africa to further my education, and later in 2019, I settled here in America. So that is me in a nutshell. I am so excited about this panel today because I want to learn how to start doing research at the university. I believe this will allow me to learn something new, challenge myself in different ways, and learn from my mistakes. This series aims to empower first-year graduate students like myself in gaining confidence to conduct research. As a reminder, please stay muted for the duration of the programming. This program is being recorded, and so please only use video to your comfort level. You are welcome at any time to today's program to put your questions in the chat. When it is time for our Q&A section, Delaney will take messages from the chat. If you have any difficulties with Zoom, please message Delaney Anderson for assistance. It is my pleasure today to moderate our panel with two second-year maternal and child health students. Before we get into our questions, I would love our panelists to introduce themselves. Can you tell us how you're doing today?
Hey y'all, my name's Hadija. I use they, she pronouns and excited to be here with everyone. I am coming off of a doozy of a day. We were discussing as we were setting up that it is the end of term A, the last week, and so I think a lot of us are feeling that right now amongst all of the other obligations. My twins have colds and it's just, you know, life. So yeah, excited to be here.
And hi, everyone. My name is Delaney. I use she, her pronouns. I am also a second-year maternal and child health student at the U. Also equally tired with classes. And with my first half of the term class finishing up this week too. In addition to being a student, I do work a few jobs. I am on the PRAMS team for the Minnesota Department of Health, which is the acronym stands for Pregnancy and Risk Assessment Monitoring System. And then I'm also a graduate research assistant with the Center for Urban and Regional Affairs, working for a rural nonprofit, which is a big old mouthful to say I help out with research and I'm paid to do it too.
Wow, thank you so much for being here today. So we'll just dive into our questions. Can you share what type of research you personally have participated in?
Yeah, I can start us with that. In my first year as a graduate student, I've actually done a few different types, and I'm going to kind of walk us along our path. Before I was in graduate school as an undergraduate, the only research experience I had was working in a nutrition lab where I was told I have very big hands and I was great for handling rats. And so the only experience I had before starting graduate school was working for this one professor doing rat dosing studies, which meant grabbing them and collecting blood samples or providing them oral solutions, because again, it was nutrition. So when I came to graduate school, I had never had opportunities to work with people, to work with large data. I just really helped make data as an undergrad. So when I started in the fall taking biostatistics, I fell in love with it, and I wanted to do really, I think, I wanted to do a data analysis that was pushing the boundaries of what we had kind of talked about regarding racial and ethnic categories, because I have a lot of issues with how we define and label people. And so I used my training in biostatistics to use census data to talk about financial disparities among Minnesotan women, which is still limited by how we define people by gender when large data sets. And I broke it by ethnic categories, and very intentionally so, by definitions that communities had shared themselves are more meaningful than just large groups of Asian and African, when that doesn't speak anything to people's cultural values and practices related to those. And so I completed that at the end of December of my first year of graduate school, and then started entering that data analysis into a few conferences. I actually wrote a piece detailing what that work meant to me, which I can share in the chat and resources later. After gaining that experience, I leaned heavily upon my advisor and some of my peers to design an IRB approved study to do qualitative research. And we can talk more about this later maybe, but qualitative research is really the idea of interviewing and focus groups and talking to people about their experiences, not just a survey of checkboxes, yes or no. And I fell in love with qualitative data because I think it allows folks to define problems and issues and experiences for themselves. And so we're still in the data analysis part of it, but we were able to design a study and get funding for it to adequately compensate our participants and for their time and their energy talking about their experiences of social media content as it related to diet and exercise in relation to their body image. So a kind of sensitive topic for sure. And that's where we are now. And I feel like I'm going on for a while. Apologies, Hadija, but I know you're going to share too. In my graduate research assistantship, I helped conduct focus groups over this past summer. And a really unique and wonderful part of my research assistantship is that I was paired with a rural nonprofit to conduct research for them, specifically to do what's called community-based participatory research. And so individuals from the nonprofit and the communities that they serve helped directly inform our research questions, our protocol, what we were trying to find meaningful data for, and then provided me feedback as I helped them carry it out over the summer. So I'm actually going to be doing another webinar in November talking about the specific findings from these focus groups. But again, it was qualitative data, which I absolutely love. So that was a long time of me talking. Hadija, what about you?
No, it's all good. It was nice to hear about some of your experience. So the question was like sharing what types of research we've participated in. I actually want to like take a really quick step back and just like focus on like what is research, because I think that is really important. And I think, you know, we are a part of a land grant research institution, and like what does that mean too, and how we actually approach research, because, you know, as students, there is this definition of research that it is, you know, quantitative, qualitative, or it is CBPR, or it is all of these things. But like at the end of the day, it's inquiry. Like we're trying to learn something to improve the standing of society. And that can look a lot of different ways, and that can also not be formal. And I think, you know, a lot of the research that I've been a part of has been informal. So, you know, doing listening sessions with and a part of community, and then using that as a really rapid response, you know, organizing tactic to, you know, nimbly respond to times of crisis. Like that is research, I would argue, but in terms of the clout of the ivory tower is often not accredited. So in that regard, like I've done a lot of research because I'm a community organizer and I'm continually trying to poke and prod systems to make them reevaluate their structure and really change. Now that I'm in the university system, I'm doing things that are a little bit like more formal research, and like being a part of, you know, a QI project right now, and QI is quality improvement. So, you know, that is defined as not research, so it doesn't need IRB approval in the same kind of way, and it is that more rapid response iterative program. But that's an arm of a thing that I'm involved with. I'm also currently doing statewide coordination and needs assessment for COVID vaccines for young folks experiencing homelessness in the state of Minnesota. And like, you know, that is not funded in a traditional research sense, but it is gaining information with and alongside community to be able to uplift voices that often are pushed to the margins and don't get centered in terms of responses. So yeah, those are some of the things that I've done in terms of research and kind of my mentality of research as well. So.
Adija, I want to think about that comment you said about like formal versus informal, because I think that's just such an important aspect of how we value research, right? Like, I mean, I aspire to be more like you every day. You are my role model. So this is like such a fun conversation to have, because for me and those projects I'm talking about, like the one that like really gets to my heart is like the qualitative, like the interviews we're doing right now with young women across the United States. And we were really intentional that our end products, we don't want it to just be a manuscript. We want to make an information sheet for folks who are going to be working potentially with individuals experiencing mental health crises or issues with body image to use in talking about these issues, right? Like, and that's something that I feel us as students, we don't get empowered to say, how are you going to make this an action? But just, you need to publish, you need to get this done. And I think in some ways, participating in individual research, or like what you were saying, Hadija, like in community, helping out, whether it's an official organization or just a group you care about, you absolutely have the power and the skills in this to be involved in doing things that matter to you and that can help your community. Like I really want to highlight you saying that it exactly does not need to be formal. And to me, it can be really frustrating to feel like so many funding opportunities are hidden in that formal setting. And I know of some wonderful researchers and professors who do a good job of navigating the systems to get what they need from these spaces that have resources to then funnel outside. And that's where I really want to go. And I don't know the perfect ways to do it yet, but we can try every day, right, Hadija?
Yes, absolutely. One other thing to add to that too is like, I think really like centering on anti-oppressive strategies first as students is a really great way to get over the like falsehood of like, can I do this? Because I know one of the things like about this conversation is just like how to support first year students in like finding their research voice or place. And it's like, you have it, whether or not you're within a university system or not. But there are falsehoods that are told to you that like you said, Delaney, of like needing to publish or like that being the end goal and like really kind of perpetuating extraction. That just like if you are anti-oppressive at the core, you're not gonna you're less likely to fall prey to some of that wonk. So
Thank you so much. I really enjoyed listening to you both. I really enjoyed the part that you talked about research can be informal. And yeah, thank you so much for sharing that. So we'll move on to the next question we have for you here. How do you participate with underrepresented groups without extracting from them?
Yeah, I can start with this one. If I were to be up here and say that I have done that successfully, to me, that would be falling prey to extractive techniques, because to me, it's all about being in continual relationship and in continual conversations of accountability that are never done. So if me as quote unquote researcher says that like I am not extractive towards the communities that I work with, I would have red flags all over and say like, nope, I question that, because you saying that you aren't causing harm is not uplifting the community that you're intending to serve. And so getting uncomfortable and knowing that it's not personal and that you are continually having conversations with yourself and the communities that you work with, even after your quote unquote research project is done, is I think a first step, and really laying out like what does accountability look like, and what, you know, if I get called in, called out, like then what? Because that's also labor on community to put me to task. And 20 years down the road, if I'm no longer, I've published some paper and I'm no longer still in relationship, like to me, that's A, extractive, and then B, not centering accountability in it. So.
I totally agree with that. I'm forgetting the exact term of the concept, but it's the idea of coming in when you care about an issue and staying for the long term, not just for the project, like staying engaged with that community after the fact too. Something I've been thinking about a lot with one of the projects I'm involved in with folks we reached via like social media advertising nationwide is, right, like I'm not going to be able to follow them, all these people individually. They're not necessarily part of a community besides the initial inclusion criteria for our study. But one thing we were thinking about when designing the study is being really intentional about the questions we were asking and why we were asking it, and to not ask questions that weren't actually going to be important for talking about this issue. I see it a lot sometimes, even as a peer, that somebody will be designing something and they'll be asking all of these really invasive, like demographic questions regarding sexual orientation, regarding gender identity, regarding really like personal things about income and all of these different pieces. And I always take a step back of, do we really need this information? Is this something that you actually need to ask, or you feel like you should because that's what everybody collects on a survey, and this is what everybody says are the demographics we need? And pushing back on those ideas of what data do you actually need? And if you need to have it, you need to be able to explain why, so that when you're having those conversations with someone potentially asking these questions, it makes sense and it's important, and you can say what it's going to relate to. I think that's something that we don't necessarily get trained in. We just are like, these are things we always have in a data set, and that's not like the bare minimum. That's not why it needs to be included. You need to ask, when I ask this question, especially if it's going to be a hard conversation, right? Like our conversations about body image, like that's can be really heavy how somebody views themselves. And we did multiple iterations of our questions and talked with people within like our inclusion criteria, within the demographics that we had specified, to be like, how does this read to you? How does this come across to you? And so I think that's just something that we don't push back on ourselves and make ourselves explain every decision we make all the time as potential researchers. And that should happen more often. And it should be comfortable to say to your peers, why are we doing this? Because there's so much that idea of I need to be right and I can't face criticism, because if I have criticism, that's bad. And moving away from that and really requesting feedback from peers, from your advisor, from other folks doesn't mean you're a bad student or a bad researcher. It means you want to have that conversation and you want to improve. And that's a very important hill I die on, of if you're asking a question, you're asking something, you're taking from a community, it needs to be purposeful, and you can explain to them why you're asking something.
Wow, thank you so much, Delaney and Adija, for sharing this wonderful piece of information. I just kept taking notes of everything you were saying. And yeah, you talked about when we want to do a study design, being intentional about the questions we ask and why we're actually asking those questions. That's something that will stick with me. And yeah, thank you so much for sharing that. I think from everything both of you talked about, that you emphasize the importance of actually doing community-based participatory research. And thank you so much. I can't wait to get started. All right, so we'll move on to the next question. How much support did you have when you began? And how did you get started?
I can start us with this one. I think I already shared that that answer was zero, none. Especially, Hadija, I'm interested to hear your thoughts, but starting graduate school during the pandemic was like, even like regular kind of opportunities for research were like even smaller because folks hadn't really adapted to being virtual yet. They were like, it just was not happening. And so I initially came into graduate school with like a very, I don't know the right word, but like just I'm embarrassed to think about past Delaney of like, I have to do research. I need to do research. Like this is important. Like I need to graduate with this experience. And so that's really when I started my data analysis using secondary data. And I'm so thankful for that experience. And I know now how to like work with big data. But at the same time, it was just that mindset. I really wish I could like talk to myself and be like, why? What, like for what purpose? Because now the experience I'm getting doing this work with qualitative interviews and focus groups, I see directly informing my future. I want to become a rural physician and I want to be an advocate for my community. So I want to be able to have a focus group, a listening session, interview folks and be able to translate that into worthy evidence for policymakers and people who make decisions about money and resources for my future community. But when I started, it was me and my computer and a bunch of emails to my advisor saying, where the heck do I need to go? And I think that's a good thing I think about graduate school, that there are folks, you're in your advisor who should be able to help point the way. But I've also, as I've grown and checked myself of why am I doing this? Why is this important to me? I've also found people who are not related to academia who are doing that and pushing me and saying, this is information we need and you can make it in a worthwhile way. And that's why we want your help and we need you to work on this. So I would say in all of that as well, something that's just been really successful is bringing my peers in and asking my friends and asking other folks what they think. I think the worst thing you can do for yourself is think you're the only one who can do it and you have to do it alone. And that's just wrong. It's just wrong. I'm flabbergasted to think of it another way, or how I started thinking I need to do it by myself, because it's having my peers and my advisor and other people I trust in my life to talk about these issues and get pushback that are making me grow as a person, as a researcher, and as a community member. So.
Thanks for sharing that, Delaney. I appreciate it. Yeah, how much support when you began? I guess like the question is like, when does one begin? I'm gonna just keep making these things, take your questions and smash them. No, I'm just kidding. So when I started at the U, I think I've had kind of a surprising amount of support, or at least more than I was expecting. I think my time so far at the U has been very strange and not at all what I was expecting. Shout out to Dr. Kumi Smith, who's been a huge champion and pusher and co-conspirator in different pots of work that I've been doing. And also shout out to like the Health Equity Work Group, because they were also co-conspirators last year in terms of supporting some work that I was doing. So I feel like in the sense of my time at the university in graduate school, I've had a decent amount of support. Yeah. And thanks to all those folks who have supported me. So yeah.
Thank you so much for sharing that. It's very interesting and encouraging to note that, you we don't necessarily need like a prior experience to get started in research. And that actually makes me feel like happy, because, you know, sometimes getting started, that initial fear of just, you know, getting started kind of hinders one to get into research. So I feel so happy hearing you both say that, which is very encouraging. And you both mentioned something very vital, which is also involving our peers in what we do, and just knowing and understanding that we can't do it by ourselves. We need people, we need those feedbacks. You know, it's okay to accept criticism. It's to give room for improvement. And thank you so much for sharing that. I really appreciate. Okay, so we move on to the next question we have for you. Are there any resources you recommend? What resources do you utilize? How did you get funding for this work?
I can get us started, but I also want to reply to one of your comments, Chinenwa, that idea of like imposter syndrome and like, I'm not good enough to do this. It's just absolutely a falsehood. And I think it's perpetrated by academia to say like, only me with my super advanced degree can do this work. You, with your lived experience as a community member who have seen this reality of whatever we're talking about, potentially researching in public health, can't speak on this issue in an informed way. And that's just, I may get in trouble for this, but that's ridiculous. And it's pushing back even as a student, but hopefully with the training you get as you become a professional and in whatever space you work in, to help lift up those voices around you, right? I should not speak for a community I'm not part of, but I have the skills to format what they're saying into what's called worthy evidence or important evidence, to use rationale for financing, use this rationale for programming or whatever those things you might need to get them is. Maybe that was grammatically correct, maybe it wasn't, but regardless, I really want to push on that point of like imposter syndrome is only felt by people who really care, I think in some ways. Like I think it's folks who are like very empowered and don't necessarily come from a place of like not feeling confident, that are the ones you gotta watch out for. Which was like me last fall. Like I think I was overly confident and I have to do this, I need to do this, and that's a mea culpa. I think I should have gone about things differently, but irregardless, I just really want to push on that idea of you can do this, and that's why you shouldn't do it alone. That's why you should solicit feedback. That's why you should be involved in a community or with peers doing this work. Hadija, do you want to comment on that or anything before I answer the initial question?
I would just expand it to say imposter syndrome is a tool of white supremacy, and challenge that. That's all.
Sweet truths. I love it. And so regarding your question, Chinenwa, about like resources and funding, I have been pleasantly and constantly surprised how many like things there are out on the internet that exist in YouTube videos and consortium websites and other school website resources. Like if I want to learn how to do something, I will Google it, and you can probably find a bunch of like accredited institutions that have whole resource websites, and let's talk through how to do this. And here's sample formatting. Like there's plenty in regards to that world that you do not have to pay for. Like just if you're like, I really am interested in this type of thing, or I want a sample template for this type of work, like you can definitely find that. In regards to funding, I was really fortunate to get a grant from the Community of Scholars program here at the U. Last year during the pandemic, they had turned their travel grant into research funding grants. And that's what we were able to apply for and get to compensate our participants. I don't think it still exists. I think they've turned it back into a travel grant, which I think is unfortunate. It was really helpful at that time because I was having a lot of trouble as a student trying to find funding for participants. because that's also just a really big barrier in research grants. I don't know if you've seen that, Hadija, but like asking for grants to pay people for their time and energy, like there's a lot of institutions that don't think that's worthwhile. And that's just, it gets into the cycle of, wait, why? Oh, right, because you don't value people. Great. So I would say be inventive and find allies in spaces that are like, see the value of what you're doing. And don't give up on your values and your beliefs, because we can make the world change, but you should not change for them if they are not willing to budge. Sorry, I'll step off my soapbox now.
No, that's great. I was really curious to see what things you would say in terms of resources, because I feel like you have a different kind of like tap in than I do. And so I was like, what's about to come up here? The insider scoop. Yeah, so I guess resources and funding. So I'm the founder of something called the Healthcare Reparations Cooperative. And so I'm constantly in a dance of finding funding for that work, to be able to bring on other folks to the cooperative and honor their time. And that's outside of like academic funding. So I think that's something also that's important to note, is that like academic research funding is weird. It just like there's so much to it that is just like, what is this line item, and how there's like mystery numbers that I need to allocate for somebody's desk in some corner of a room that like they actually won't use. It's very strange to me. Versus like grant funding that can be used in a lot of other ways as well, but may not have often doesn't actually have that kind of admin overhead as a part of it, which is good and bad, depending. So, you know, I've applied with the help of a few faculty to a handful of research grants, and it was a whirlwind of a learning opportunity to be like, all right, dear CDC, let's go, with my little first year hat on. Oh my goodness. So Nancy Sherwin, shout out to you. Yeah, so you know, there are funding opportunities that exist. There also is the barrier of, if you don't have certain letters after your name, you can't access those dollars, which is really problematic. And then also within like the university system, if you are applying for academic funding through the university, like what does that then mean in terms of who and how people can and will be compensated? And then what does the university, like what gets allocated to the university, which is a thing that exists. And I feel a little afraid to like comment on that in this space because it is a university sanctioned conversation. So, but yeah, yeah, it's a weird space to navigate, especially if your research is focused on folks who experience systemic oppression or who may not be able to access like basic human necessity things. And then you're applying for this grant that, you know, allocates $60,000 towards desk space that's not actually going to get used. And then the grant has limitations on how you can honor the wisdom of community. And you have to then be the intermediary that is representing the university system that then says like, hey, yeah, so I want to hear about like how you can't access a box of Cheerios. And like, I'm going to potentially then take that back with all of this like optic funding I have, but like, I'm still not at the end of the day going to actually be able to get you that box of Cheerios, but thank you for telling me that that's something that you need and can't get. So funding is weird and terrible and I hate it. And like hashtag capitalism sucks. So, you know, when doing ethical research, whatever that may mean, like that's something I'm still really exploring because I think ethical and research are actually not in synergy together, and I don't know if they ever can be. That is something you need to sit down and have a conversation with yourself about, of like, do I have the gut for this to actually be that intermediary, potentially? And I know not all systems are that way, but it's something that I think I would love it if we as students had a class that like really just hammered that out and really like let us sit with some of these confusion points before we then go into the world, and potentially perpetuate harm, and really get to like get our ducks in a row about like how do we actually work against those systems and question them. So someday, ciao ciao. Yeah, so anyway, funding's funny, and it also exists, and you can do a dance around it in terms of being able to get it. So yeah.
Wow, thank you so much, Hadija. I think it's actually good to note that, like, to be aware of these challenges that exist with funding. And I really appreciate you letting us know where to get funding for our research. When I start doing my research, I'm looking forward to starting pretty soon. And just knowing that there are resources out there, there are fundings, out there to help with my research, but also to be aware that there are also those barriers so that I don't get disappointed, and just to prepare me ahead of time to know what to expect, to know what's there to stand against. And yeah, victory is for him or her who doesn't give up, right? So to just keep persevering and knowing that I got this. And I really appreciate the word that Delaney said. And, you made a quote. You can make the world change. You don't have to change for the world, right? And that's actually made perfect sense to me. Thank you so much for that quote. I'm going to hold it very dear to my heart and just remind myself each time I start getting overwhelmed with all the issues surrounding research, to just try to remind myself that I don't have to change for the world. I'm here to change the world. Thank you so much for that. So we'll move on to our Q&A section. Delaney?
Yeah, I have one ready, but I just want to check, does anyone in our audience have a question? If they want to unmute and say it or throw it in the chat. All right, then I will get us started. The question I got was, how do you translate your results into communications for your communities? Adija, do you want to start with that one?
Sure. So I can give an example of something that I'm working on right now. So in terms of results, I'm doing some survey data from young folks across the state of Minnesota that not only incorporates them giving feedback on question wording and having, the design of the questions that are being asked. They are also then participating in art that then gets used in the shareback and data collection. That then is going to be, the report back is going to be an artistic collaboration zine that reports back all of their wisdom that can then be kind of a guerrilla tool to use across the state of Minnesota to hear trends and themes around young folks and COVID and vaccine values. So, and if you don't know what a zine is, it's a small little like DIY magazine that you can make yourself if you were born in the, or if you were around in the 90s and early 2000s, that one's for you. Yeah, so I incorporate a lot of art into my work, and participant created and curated art, and that's how I report back my findings, then using their words. So I don't know if that gives you a good example.
I love that. For my work personally, I did a few things to kind of break it out of like formal academic jargon. One of the resources we can share after the fact is a like kind of almost magazine style article I wrote about my research findings, and also connecting it to me personally. And like this was the data that dealt with income inequities among Minnesotan ethnic groups for women specifically, and in it discussing the exploration of my own identity. I struggle with my identity as a Hispanic, as a white woman, and where that shows up in spaces, especially in terms of recognition and how I'm viewed and how that affects me and privilege and a whole bunch of things I won't keep talking through in this moment. But making intentional products when you're doing research, with products maybe being the wrong word for it, but how you want to share what you found in an understandable way. Because when you think about like what we're trained to do with academic writing, not many people can read what we write, like how we do diction, how we frame our ridiculously long run-on sentences. Like it's just inaccessible for most of the public. And so making, I think, a portion or trying to think about your findings and finding an alternative way to share that, whether that's in like newspaper op-eds or like writing a plain language summary, or making sure you can share it and it's accessible to folks outside of an academic manuscript article, I think is really essential if you're going that route. Otherwise, there's just a whole like group of literature we don't talk about in academia that's called like white and gray literature. And it's like reports and findings and takeaways from things that are just not published as peer-reviewed pieces, that like plenty of what huge institutions and reports and places doing research share. So there are different ways to share outside of what I would say we're trained to do as academics.
I want to bounce off that and touch a little bit on publication and kind of that world, because that is a part of the formal research process. And it's something that people aren't really taught how to do. And two, the journal world is rife with issues, and it's very behind closed doors. And so one of the things that I actually did this past year was reach out to journals that I was interested in publishing in, and reach out to their editors and really simply ask them, like, hi, my work is focused on anti-oppressive strategies to public health and liberation first approaches. How does your journal support anti-racism and being active and being anti-racist? And how does your journal center folks who are pushed to the margins? That was fascinating to get responses or not get responses. And it's something that like I actually really wanted to just try and find a journal that aligned with my values. And it was incredibly enlightening to find how many did not, or just were kind of complicit in not being active in their thoughts. So it's something I would really encourage anybody who's like going into the publication sphere of things to really think about what are your values that you're putting out into the world, and how does a journal uphold your values? And if it doesn't, then I would really push you to question, is that a place you want to publish in? And I know there can be pushback on that because, like, yes, publication is one of the things that is important in the research, blah, blah, blah. But if there's enough people questioning this, then maybe there can be some actual change that happens, because actually the journals exist for us. We don't exist for the journals. And I really encourage you to refocus your thought on who owns the power in that, because it's not them, even though they think it is. So.
I also want to jump on that idea too of like, I love that you just emailed them. And I think that's something like we feel so unempowered to like talk to people. And I remind myself and like my mentees and folks and anybody, like, if you can find an email for someone and you actually have a question for them, the worst thing that happens is they won't respond. I mean, maybe they'll send back a rude email because they're having a bad day. But besides that, like, that's the worst thing that potentially happens. On the flip side, you get valuable information. You could make a connection. Like, so many things could happen when you reach out. And so just in regards to research, I think that's a vastly underutilized, like the cold email of, hey, are you interested in this? Or I'd love to have a conversation about how you did this. I mean, something I do personally, like when I watch YouTube webinars and I'm like, oh, wow, that was really interesting. And they normally always at the end of their slides have an email of like, reach out with questions. I'll literally email like other students or other professors or people to be like, I really enjoyed your presentation, or I have a question about your methodology. Can you share with me like where you found XYZ? And I've been able to make all these fun little informal connections with students and professors who are like, oh my gosh, yes, let me talk to you about this thing. Let me share this knowledge with you. Let me help empower you. And I think we forget sometimes in the scheme of the world, right? We're all humans and we're all like, we love connection and we love talking about things we're passionate about. And so if you can make that space for yourself too, to send that cold email, you might be able to find a co-conspirator, somebody who wants to work with you on something, somebody who maybe has funding or who just loves your idea and wants to cheer you on from afar. So I really just want to empower you. Send the cold emails. The worst thing that happens is they get deleted. One other question I have before we'll head into our closing for us. How do you balance communication amongst diverse participants in communities?
Yeah, this question, like communication in terms of just like, let's have a conversation, or the whole gamut of like, yeah. Can you help me?
I would think under the scheme of either.
Okay.
What feels comfortable? Go for it.
Okay. Well, I think one of the things that's really important for me in my work is to involve community. And if community is involved and like when I say involved, not just in the like, hey, what can you give to me, but the like, hey, I'm going to hire you and we're gonna work on this together. To me, that's a really great step in terms of balancing communication. So as an example, for the COVID testing I designed, we had folks from community, from deaf community, from queer community, from Latina community, from the Somali community, as hired folks to be a part of the team. And they were able to communicate not only in languages that I don't speak or sign, but also just in relationships. Communications, not just I tell you this and you respond. It is also like, how can we form and build trust, and having folks who are a part of the web of space and time and people is communication. So
I can add on. I don't think I've mastered this yet in terms of like translated research. We really struggled when we were designing our study to do the nationwide kind of gathering of folks and their virtual interviews about how to be able to include folks who speak different languages. And us on the research team, none of us had a second language that we could have like conducted interviews in. And we also didn't have access to funding to actually pay and hire translators. And we did a lot of reflection and decided that just with our bandwidth and our funding, we couldn't. And that's something we're planning to note in everything, that we didn't have the access to translators. And we didn't also want to like Google Translate everything and like do a half done job of it. Like we wanted to be intentional of, we can't do this well or even adequately, so we're not going to. And it's something I want to improve on in the future, and being intentional of that's maybe something I shouldn't have budged on. And like, I need to find the better funding to make sure that we include other folks, because there's going to be different experiences for people who speak different languages and have different cultures and practices and all of these other things, and how they experience, online media, which is predominantly in English. And so that's something I wish I want to acknowledge. I wish we had done better. And I think that's part of it, of growing and learning and acknowledging where things failed and don't work the way we wanted them to. So that's something I'm still working on. And I think it's important to share where things go well and where things have not. Do you have anything to add, Hadija, before we head into our closing?
No, I think that's great. I think, and I also think in terms of translation services, there is a really big barrier for funding for that. So that's also something to name.
Thank you so much, Delaney and Adija, for taking your time to be with us here and share your experiences with us. I was just busy taking notes of every single word that you were, putting out there for us. I really appreciate everything that you said. And yeah, I'm so happy that I attended this event, because I am very passionate about research, especially the community-based participatory research. And, being able to conduct focus group interviews. And I really appreciated the part where you talked about communication and how important it is to include people that don't speak English as their official language. And just to be proactive, to think about these things, even when looking for funding for our research, and to make our research so much more inclusive of everyone, so that no one is left behind. Thank you so much for sharing that. And to our viewers today, thank you so much for joining us today. I really appreciate you coming here, and I hope you've learned from our panelists today. If you have any questions we didn't get the chance to answer, please send us an email with your questions at sphmchig@umn.edu. I repeat, sphmchig@umn.edu. And we will try our best to answer all your questions. As a reminder, this panel today is part of our Diving into Research series. Our next section is in November, and it's going to be discussion on how to conduct secondary data analysis. This programming is led by the Maternal and Child interest groups at the University of Minnesota. Thanks again, and we hope to see you in November.